I imagine a system where all of our wonderful individual providers and dedicated support staff and systems of care have the capacity to prevent behavioral health issues, address them early in terms of diagnosis, and treat them so that we have better outcomes when it comes to behavioral health in our children and youth.
We have had many conversations. It's time for us to act.
The Student Behavioral Health Incentive Program aims to enhance access to behavioral health services, early intervention and prevention in or near school campuses, where the kids are.
This initiative is absolutely imperative so that kids that are going through some of the most traumatic times of their lives can actually have people connected to them that can actually make a difference, a real-world difference for their future trek and their future journeys in life.
By leveraging our resources together to reimagine and redesign our systems of care for our youth, we can ensure that the underserved are being served, that our community needs are being heard and being met.
Jonathan was dealing with stresses of us no longer having a home. A lot of us can't afford health care. So if we're not good, our children aren't good.
Trauma is so complex, and trauma has an accumulative impact on kids as they grow older to adolescence and adulthood. And SBHIP seeks to connect disconnected systems so that no child falls between the cracks.
These are real stories that are happening in our school districts and in our communities, but it would not be possible if it wasn't for all of you and your passion and your dedication to all of our students.
This is fully LEA's voice designing these programs, and they know what they need. What we're doing is building a sustainable infrastructure so that schools can offer these services, expand what they have, to improve access to preventive early intervention and behavioral health treatment for students K through 12.
We talked about leveraging resources. How does First Five fit in as a partner?
One of the things that we've been tasked to do is increase access on or near schools. So that opens up an incredible opportunity to identify our community-based organizations like First Five and others around the schools that we're working with to engage them.
We can't exist in the silos that you all were talking about earlier, right? But transformation and solutions and innovation and beauty exists over in life's endless possibilities. It doesn't exist in our comfort zone. But it's because all of you drive me to know that we're right in thinking there is a better way to do this.
Why can't we make the world a better place for the children in this community? Why can't we break down that silo? Why can't we develop that partnership?
We're fully committed to continue to advocate and collaborate to make sure that the best supports are put in place for our students.
I believe that our students, our families, our community will be free at last from the burdens of trauma and all that comes with that.
And I know that support will continue as we develop this infrastructure and sustainability plan to support the behavioral and mental health needs of our students and their families.
IEHP is committed to engaging with our communities and partners to bring these new school-based interventions to life so kids like Jonathan can thrive and become amazing adults.
It's a game changer.